Good evening. My name is Desiree de Guzman, and I have chosen to take the career path of becoming a mental health counselor. Mental health counselors evaluate their clients' mental and physical health by assessing their readiness for treatment and work with individuals, couples, families, or groups. And when they work with individuals, it's a one-on-one session. They can work with couples um, such as marriage counseling, or families when a child is suffering from a mental disorder and help the family integrate that into their life and learn how to cope with it all. They can also work with groups or administer groups such as AA for Alcoholics Anonymous, or NA groups for Narcotics Anonymous. Their scope of practice is also within a private, federal, or public sector. And with that being said, they have many options of where to work. While working, mental health care counselors are able to work with physicians in order to touch base with their clients' other medical histories, as well as nurses, and how the nurses can help these individuals that have mental disorders, um, help better aid them. And mental health care counselors also work with psychologists and psychiatrists in being able to prescribe their clients medicine. The daily duties of a mental health counselor are to develop and recommend treatment goals for their clients. They also evaluate their clients from the beginning, the middle, and the end of their stay, and how many times they come a week for sessions. The mental health counselor also teaches and treats their client by giving them exercises on how to cope with mental disorders or their symptoms of their mental disorders, such as meditating, speaking in a group, or even talking just one-on-one with them. They also conduct programs such as the AA meetings and refers their clients to other physicians, such as a psychiatrist, for medicine. Mental health counselors are able to work in any mental health center, a prison or probation agency that help guide prisoners and inmates that have mental disorders and help them get the correct care that they need, since their brain and mannerisms are different than people with non-mental disorders. Mental health counselors can work in halfway houses, hospitals, such as outpatient treatment centers, and within a school setting. Within a hospital or outpatient center, can work bedside with people that are just have a terminal case and want to make sure that their mental health is still 100%, and that they're not feeling any depression or anxiety about the process that they must continue. Also, in schools or halfway houses, a mental health counselor can help any individual with any addictions or any bullying per se. In order to become a mental health care counselor, an individual must obtain a bachelor's degree and earn a master's degree under counseling with a degree of counseling. They also need to register within the state for an internship and get supervised experience hours. For USFs, it's 1,500 hours or more. And they also need to take the CRC exam. For the CRC exam, they need to fill out an application that provides them with a test date, also pay the fee. The exam is about 3.5 hours and includes 12 knowledge components, which test different parts of what it takes to be a mental health care counselor, and they need to receive a passing score. Other than the CRC exam, the individual must retain a license, as well as take a law and rules course, a human immunodeficiency course, and a domestic violence course. These 3 courses will help the mental health counselor be able to assess when authority needs to be contacted for the patient. The human immunodeficiency course will help the mental health counselor realize that some mental health issues um, come from a lack of immunodeficiency, such as someone that is under dialysis and waiting for a kidney transplant. They may be more susceptible to a mental health disorder such as depression. And domestic violence course will teach them about abuse and how abuse is related to mental health. Continued learning for a mental health counselor, you have to have 30 or more hours of continued learning every 2 years, which means you can do it the first year, the second year, but by that third year, you have to redo that 30 hours. They also can look towards the Florida Mental Health Counselor Association, the American Mental Health Counselors Association, or even the National Board for Certified Counselors in order to get more information about their jobs and their careers, as well as support when they may not know some answers. My 5 year, just at a glance, is to finish this project as well as finish my memo assignment and then take a final exam, and graduation for my undergraduate degree is going to be May 4th. Then I'll be leaving the country for a bit, but when I come back in June, I plan on start looking for jobs within the mental health career, so I can gain experience that will go towards my master's application, my graduate application. In July, I plan on registering for the GRE test that takes place in October on the 6th, and then in November, the GRE scores will be mailed out. I will begin my graduate application after those scores come out, which should be no later than December, the first week of December. And then the application for the USF Rehab and Mental Health Care Counseling is due the 15th of January. And then after that application, interview process starts March and ends in April, as well as admission acceptance letters will be given out between March and April after the interview process. In August of 2019, the program for rehab and mental health counseling will begin, and I will graduate. Commencement will be in December 2021, since the program is 2 years long. After graduation, so January of 2022, I will register for an internship within the state, as well as start obtaining my 1,500 or more supervised hours of experience. After gaining that, or while I'm gaining that experience, I will take the licensure exam at least before the 2 year mark of from when I had graduated, and then I will receive the exam grades in December of 2022, and with a passing score, I will be able to start practicing my mental health care counseling career in the beginning of 2023.